Now we're going to deal a little bit more with sacroiliac joints. Now the sacrum is a triangular bone at the end of the spine, so you've got all your vertebrae come down, and then the pelvis is attaching to the very tip of the spine, and it's wedge-shaped. And the joint in between those, the pelvis and the sacrum, is called the sacroiliac joint, or the iliac part of the pelvis and the sacrum come together. There should be a slight amount of movement there, and actually anterior posterior is where I usually see the movement. But sometimes a patient will do something that will be too long on one leg or something like that. They'll stand on one foot. The thing I've noticed on myself is if I'm trimming my toenails with my foot on the sink so I can get right to it, well, I'm crooked for 2 minutes trimming the nails on that one, and then when I finish I go, something doesn't quite feel right in my back. And that's what I've done. I've too long, and it's rotated that little bit of my spine so that it gets stuck in the wrong position. So over the years, just the last 2 years, I've come up with a way to mobilize that's real easy. I don't even have to touch the patient. That works on most people. There's several ways that therapists we have to mobilize it, and I won't go into the other methods, but this way is real simple. I'm having Maxine sit on the edge of the chair. I prefer it being on a bed, but this is what we have here. And then
that's too high. Too high?
That's too high because I need her feet on the floor. Okay? So a really tall bed, that size might be okay for me, but not for Maxine. And I like it on a bed because when I do one other activity, to get a lumbar stretch, the bed actually will compress and it tractions. So I'll show you that in a few minutes. But what I'm going to have her do is to lie down flat and all the way down. This isn't the most comfortable chair, but it's not bad. Now, by lying down that way, her quadriceps are just a little bit tight, but not too tight yet. I'm going to have her pull her feet back underneath the chair a little ways further till it's, there you go. And now the quadriceps in the front here is real tight. That's tilting the pelvis forward, which is arching her low back. When I do that, my back can pop fairly easily. Even just to get in that position, I feel my middle back pop. It realigns, and it relieves a lot of the tension that I have in my paraspinal muscles right along the center of my back. Now I'm going to have her raise her arms above her head and just let her stretch there for about 1 minute to 2 minutes. This is what I used to do only. I would get really good relief of my upper back tension, and within 1 minute or 2 I could go back out and work again. I have a fellow that does the beauty salon at our nursing home, and after working in his arms, doing hair and curling and everything, his back gets really tired. This is just like mine. So I showed him how to do this, and he goes, "Wow, I feel like I could see 4 or 5 or 6 more little grandmas now." He said, "I didn't even think I'd get through one more person." So he was amazed, and it really helped him.
I get a little bit more, I saw where I took my hands this way, and that it gave me adjusted in the middle a little bit.
A little more stretch. Oh, she's putting her hands flat now, hands down. Okay, good. One other thing I do with this now, this position, having the feet tucked under, locks the pelvis. So if she had a upper back stiffness, I could have her put her hands like this and then rotate back and forth. And we didn't have the chair there, we could rotate fully. But this way, it's limiting. There's not too much lower back rotation, it's more upper back. Even if it's up here, it's even more. And then as I can put my hands down here, then going side to side, then it's rotating, and now it's twisting more in the middle to lower part of her back. But that position locks the pelvis, so it's really quite firm, and you get all middle to upper spine rotation that way. So it's real handy, and it's a nice way to work on an upper back too. Now, she's been there 2 minutes or so. I'm going to have her keep her feet, her knees bent, but I'm going to have her put her feet out to the side. So pull your feet out to the side. Good. And now I'm going to have her pull her knees together. That stretches the sacrum and the pelvis apart. The tight hip muscles are pulling the sacrum, pulling the iliac crest, the iliac bone away from the sacrum. So her pelvis is pulling away, and it's stretching that sacral ligament that holds it together. Do that 10 times, in and out. Hold it about 3 seconds in, and then out. And then 3 seconds in and out. 3 seconds in. So I'm preparing her for the next thing that I'm going to have her do, and that's to realign the SI joint.
Will this get rid of restless leg syndrome?
No, it might. I don't know. You can try it and see. All right. So after 10 times, I wonder, that's about, okay. So this time, hold your knees together, and then I want you to try and make one side of your pelvis go down and the other side go up at the same time.
It doesn't like that.
Yeah, she's feeling that on her one side that's stiff. Which was it? The left?
The left, yeah.
Yeah.
Left side.
So sometimes I will help here, and I'll just to kind of help them learn how to do this, just to get the feel for it. Try and keep your knees together. Just there you go. With the knees together, it stretches the two joints apart, and then that allows it to stretch. And I usually have them do it about 10 times. So right, left is 1, right, left is 2. All right, that's about 10 times. Now, did you feel anything pop or realign?
The first time we did it, yes. The second time I did it, but now it's just resistant. It doesn't want to do
Just resistant, but it's still probably going to feel a little better. Now, I'm going to have her help her to sit up now, because it usually is a little bit, you just don't feel like you've got a lot of tummy strength to get up, and just sit there for a minute. It's important to just take a break for a minute, because your back is kind of been really stretched, and it feels sort of like I did when my buddy did my back massage, and I felt like I was going to fall over. So I always have the patients just lay there. My second patient I did this with was a 93-year-old lady. She was in pain in her hip and in her heel for 30 years. And and as I helped her to figure out how to do that pelvic up and down movement, something snapped in there. It sounded like something broke loose, and I was like, 93-year-old lady, I hope I didn't break something. This is only the second time I've tried this, and I was doing it gently, but something gave way. And I said, are you okay? And she said, yeah, I think it feels better. I said, well, good. We don't have to go to x-ray and see what I just broke. So then she stood up, grabbed her walker. She started walking. She said, oh, my hip doesn't hurt. That's amazing. Oh, my heel doesn't hurt either. She said, those have been hurting every step for 30 years because that sacrum was out of position, and it was causing tension and pain down her foot and in her hip. So it realigned, and she was like really grateful. We got her strong again. She had been having some various health problems. She went home in about 2 weeks, and she grabbed my hand. She said, Byron, I'll never forget you. Thank you so much for fixing my back and my hip and my heel pain. So, all right, now one more. Oh, go ahead and stand up and see how it feels.
So what does the heel pain have to do?
It's something to do with pinching the nerve, irritating a nerve that had locked in the wrong position, and it somehow that irritated that heel area too when she stepped on it.
So if someone has toe pain or some kind of other pain,
it's possible that might help. I would give it a try. Now, on that little grandma, I didn't have her lay flat like this. I had her with 5 pillows up under her, so she wasn't all the way down flat. But then I still helped her tuck her feet under and do everything else. But I didn't have her so much for arching, because in an arthritic low back, she wouldn't have that much range of motion anyway. And that much, and the hips are really tight a lot of times. The hip flexors are real tight. So So I could put a wedge pillow there. Sometimes I've used 2 wedges. And I had one younger lady that was 30, 35, and I had to use 2 wedges on her because she had so much arthritis in her low back that she couldn't lay flat like that at all. I mean, it was impossible. Her knees wouldn't touch the floor. Her legs would just come up. Real tight hip flexors and really arthritic low back. So just depends on the patient. You have to be careful. And the only contraindication would be if somebody's had osteoarthritis real bad, not osteoarthritis, osteoporosis real bad, and they've had a collapsed vertebrae. It's so soft in there that you could irritate that and make it collapse even more. Just because of the little bit of pressure, it doesn't take much. I call those soda cracker bones. They're just collapsible with a little pressure.
Soda cracker what?
Bones.
Bones.
So just like you could break a soda cracker, that's about how strong some little grandmas and grandpas' bones are. If they've had a compression fracture and they've had a kyphoplasty where they put a little balloon inside the vertebrae and blow it up and then put cement of some sort inside to give more space, it can cause that to collapse also. So if they've had that kyphoplasty, please don't do this particular treatment. Now I'm going to have Maxine lie down one more time, sit right on the edge again. This time, let's pretend she's on her bed. Actually, it might be okay to do it on this one. So we'll move these chairs out of the way.
Now, why do you need to have your feet on the floor for this one?
Just so you can reach the floor and so your feet can be out to the side. So on this one, you can lie down, put your head down here.
Have my feet off?
Your feet are off, yeah, just like that, but we're not going to put them out to the side or anything. She's going to lie down, and now she's got a little bit more arching because she's higher, but what I want to do is to show you how you can do just lumbar traction. So
Pull more than it did on the chair?
Yeah.
right now it is pulling more.
So if you put your hands back, it'll be way more.
Yeah. But ideally for her, this would be a little lower. Okay? But at the same time, what I want to do now is the weight of her legs is going to become a traction. Okay? So I'm going to have her stretch her legs out straight, and now the weight of her legs is starting to pull on her low back. So if she had a disc or a bulge disc, this is going to start pulling it and helping it to make a little bit of vacuum to pull that disc back in slightly. I did this with a guy that had a herniated disc, and in just simply doing this and the other treatment that I showed you a few minutes ago, instead of walking to the side like this, he was only 22 or 23, he was just all bent over. He was standing up straight and almost walking normal. He had a slight limp still, but in 5 minutes he was upright. It was amazing. He went ahead, he had a discectomy 2 days later or something like that. They had already scheduled. But that's just removing part of the disc that's herniated out. It's not a major surgery. It's just to remove a little section of the disc. They weren't fusing anything. So it was probably good in the long run. And I think they also sew up that little piece of where it's herniating out, so it gives it a little more strength, so it's not, or cauterize it or something, so it won't bulge out again. So what I want her to do is so if you're on your bed and you're in this position, not this tall, but a little less maybe, and then if she can tighten her buttocks muscles and tighten her quadriceps muscles at the same time,
It's hard to tighten the quads.
and like as if she's going to straighten her or lift her feet off the ground just slightly. All that is pulling the weight of her legs on the low back. You feel that tractioning it? Now if she's on her bed, then the bed could give a little bit, and it actually works better.
How
This
long
one,
do I hold the contraction?
about just 2-3 seconds, and then relax. So you tighten, kind of try and straighten your knees just slightly. That's good. She's got her toes on the floor. That's perfect. And then relax. And I've just practiced it yesterday, and I haven't really done the buttocks tightening, but it really is good for the whole pelvic area, the low back, just to tense up and then try and relax everything. And then tense up, try and relax everything. So she's tightening her quads, her hips, and then relaxing. Okay. All right, so that's one extra thing. You can sit up now. One extra thing that you can do for a strained low back or a herniated, if you've got some pain going down the leg, in the hip, that might help to relieve some of that.
Can that PT table be found in Thailand, or is it somewhere
She
else?
just bought it.
Yeah, she just got it here.
Oh,
Yeah, for about 4,000 baht, you said, or
About, I think less than $200.
$200?
Yeah, it's $200.
So that's a good deal, because to find a table this is really nicely made too. It's leather.
Yeah, you got some that got wooden legs, so you can
Yeah.
adjust the height and everything, but I didn't do all of that.
Yeah, I like the metal that's stronger, and it really is nice. Okay, I think that's enough for that now. One other thing, why don't you turn over on your stomach, since her back didn't seem to pop there. I'm going to show you one other little thing that sometimes helps with that. And it was on your left side, was it?
Yeah.
Okay. So lie down on your stomach.
Under my stomach.
Yeah, that'd be good. Okay. So right about there. Now, I'm gonna press on her sacrum. I'm just gonna check it here for a second, just to see if. Usually, I'm pressing on the sacrum, part of the pelvis, the central part right here of the end of the spine. The pelvis would be over here, and this is where the sacrum is, right in the center. And I'm pressing on the left side of the pelvis, okay? And it doesn't feel locked up like they do sometimes. Sometimes there'll be absolutely no movement there. It'll feel like one solid bone, and you want it to have a slight give to it. So it may be just a little bit more rigid than the right side, but not too much. Okay, now one thing that sometimes will help is if I have her, I'm going to press on this bone, and she's going to raise her, I'm pressing on the sacrum, and she's going to raise her left leg, and that rotates her pelvis slightly, and it puts a little stress on that joint so that it's moving forward just slightly. And I'm helping her to raise it up. Sometimes people that have this particular problem, you don't feel a lot of strength in your hip extension either. So if you help them just slightly, that helps too. But I want her to do some of the work, because that helps to get the joint moving. And this, again, doing that Superman exercise will help to keep this limber once we've got it done. And I usually try not to do more than about 10 of those. Sometimes the joint will get kind of sore if you do too many. And there's also another, when you have this problem, there's a muscle right in here called the piriformis, and it's real deep, and it's right about in here, right where the sacrum is. It comes right about straight on here, and it comes out to the hip. So if you will use your elbow, you can usually find it pretty quick. It's just a tight muscle that's right there. And most everybody will squeal when you do it. Is that sore?
I stretch them regularly.
You stretch them regularly. That's good. So, but right about in there. Yeah. So this is another thing you could do. And so if I have pressure on this, and then she's, let's see if, just move your leg back and forth there. This muscle helps with hip rotation. So I'm going to just keep pressure. You do it 30 times. And that'll help that piriformis to kind of let go a little bit. Yeah. She's being a very agreeable patient today. She's got all the right ailments.
got those. Go down there and, yeah.
Getting close to 30?
Well, up a little bit. Yeah, right in there, right there. And on my other side too. Do that. And then on my other side. I don't know yours.
And what does that do?
Well, I'm doing that the same myofascial release with exercise. So I've focused on that piriformis muscle. And that muscle, in some people, everybody has two muscles there, but in 15-20% of the people, there's a nerve goes right between those two muscles, the sciatic nerve and blood vessel. And so when it's spasmed, it pinches that, and then you have numbness down your leg. So there's different ways of stretching that particular muscle, and I'll show you that in just a minute. But it's good to try and work it out somewhat with the myofascial release and the exercise. So we can do some deep massage to it now, just to try. And again, the muscle's going this way, so I'm going opposite to the muscle, stretching it. And after you do myofascial release, it feels better if you'll kind of rub on that muscle and get some of the soreness out of it too.
So again, it's a lot of that soreness because there isn't proper circulation in that area?
Yeah, part of it's the circulation. The muscles spasm, so you don't have good oxygen to it, so it builds up lactic acid from lack of oxygen. So you need to try and, you can ice it. Sometimes they'll ice it, sometimes they'll do that myofascial release. We can also just check and see how her range of motion is on that. It's actually not too bad on those. Now sometimes you'll find it won't rotate, hardly any going in. It's that muscle moves it out, so it'll go. The foot coming in this way would be limited. I'm sorry, going out would be limited because it's stretching at this time right now. All right. So again, doing the Superman exercise is good. One side then the other, and then I want to show you just a tiny bit. Some people like to walk on somebody's back. That's too much weight. If you just have them lie down and you can use your hands, that can be the feet of somebody instead of somebody's real feet, and just gently walking on their back with your hands. That tends to just stretch the vertebrae. I had one patient. One time I told him, this is like a geisha girl walking on your back, and he said, you think you could put her on a diet? Meaning I was pushing a little too hard. That's sore? Yeah. Okay. And then if it needs to really stretch, we can put our hand here and just kind of stretching. The transverse processes go at an angle here, so I'm putting my fingers right on her transverse process and just kind of pushing at that angle. And that stretches a little bit too.
What are you doing right now?
So I'm just stretching one vertebrae on another. Sometimes they'll have a little tension in there. Again, they might be sticking a little bit, and this just kind of restores normal movement inside the vertebrae there, one on the other. So I'm
Each vertebra?
yeah, pretty much, yeah. But you can't feel it exactly, but you can kind of feel joint mobilization. If a person's having problems with their spine or their joints, to find somebody that can do joint mobilization, so helpful. A therapist. Not all therapists were trained in that. Not all have really gotten extra training in it, even though they've been trained in school. So you just want them to have as much practice as possible. There are some that are so good at this that they're amazing. They can fix almost anything. So, all right. I think that's probably enough of that for now. You want to stay there and sleep for a while?
I'll stay here and relax for a minute.
Okay. While you're relaxing there, let me show them one more thing, and then we'll take our break. For insomnia, there's 2 other little spots that seem to help, besides working on the frontal area, and that's on the big toe. Now, it seems strange, but there are some reflexes. One is in the center of your big toe, and that's a reflex to your pituitary gland. Exercise, sunshine, hot and cold, they all stimulate that, but I do this in the middle of the night when I can't go back to sleep. I'll just grab my big toe and I'll just massage in a little circle for about 1 minute to 2 minutes on both feet, and it seems to stimulate hormonal circulation a little bit more, and it puts me right back to sleep. I'll do this one and another spot that's on the inside of that, right, so it's between the toes. You find the bone and you drop under it. There's a little valley there. This is a reflex to the pineal gland. Pineal. Pineal gland is the one that makes your melatonin and 2 other anti-stress hormones. So it's a very relaxing anti-anxiety hormones. So you could do either one of those 2 or both. Now it's very interesting. But those spots, if I'll massage that on just about anybody, they will sleep most of the night. First time I ran across it, I was upset at my roommate about something. I couldn't sleep. I said, well, let me try this. And I rubbed my big toe in those 2 spots, and I slept till 7 a.m. And I told him, man, you are lucky I know how to rub my toes. He said, why? He said, I was going to punch your lights out last night about something. And he said, well, what's up? And I told him what was wrong. He said, why didn't you tell me? I said, well, I don't know. You're a doctor. You should know how to do this and this. And, you know, he wasn't keeping the place clean or anything. He'd leave his dirty dishes out, and I was frustrated. But at least I got to sleep. And that's the first time I tried this. And I said, man, that's amazing for helping somebody that's even angry about something. And I just went off to sleep. I woke up refreshed and said, man, now I can deal with the problem too. I was, getting real tense about it. So it was really a blessing. So I've used that. And the other...
I still don't understand the second spot.
Okay, this one, the pituitary is the first one, right in the center of the big toe. And the second one you roll around just slightly, and they both are right about the same level where the base of the toenail is. You find the bone and you drop under it. So it's a soft little valley right under the bone, and it feels different than the other one. The first one's more of a sharp pinprick sensation. This one's more of like you're pinching your tendon in the back of your calf here. I read a book a long time ago when I was in PT school called Helping Yourself with Foot Reflexology. A very good description of things, but of all this in the book, these 2 I've used more than anything else, just to calm somebody, to relax somebody.
So pituitary
and pineal gland.
What is the pituitary?
Pituitary is like a master gland for all of the different glands. It takes care of your estrogens, testosterone, hypothalamus. So it's kind of giving you the same kind of thing as if you ran for a mile. But in the middle of the night, you don't want to get up and run for a mile. It's stimulating those hormones so that you can just take a deep breath and relax and you fall asleep. So now let's do the other foot.
How long do you do it?
I do it about 1 minute to 2 minutes.
That's all.
On one, and then 1 minute to 2 minutes on the other foot. Altogether, it might take 8 minutes. I don't do it longer than that. I did have one patient that up at the health center, I showed him how to do this for sleeping, and the next morning the lady said, "My arm is killing me." I said, "Really? What's the matter?" She said, "I rub my toes all night long and it's just killing me." I said, "Well, I just 2 minutes in each spot and then just go to sleep." Well, I wouldn't sleep. I couldn't sleep, so I kept doing it. So, oh no. So she got real, hand and arm were sore. All right, so those are just a couple little simple things that help to kind of restore a little peace and quiet. One other quick thing before we break for lunch is that I had one lady that had an anxiety attack, was in the hospital from it, and she was so, even she came to the nursing home, she still could not talk. And I said, "Well, I came to evaluate you." No. And so I said, "I'll tell you what." After not getting anywhere, I needed to see how strong her legs were and if she could walk, and she just pull away and just kind of withdraw. And I said, "Tell you what, I'm just going to rub your feet for a few minutes, okay?" And she let me rub her feet. So I worked on her feet, multiple different spots on her feet, just kind of relax her, but especially working on her endocrine system. There's spots for adrenal and different spots, for estrogens. And I just worked on everything that was thyroid, parathyroid, on both feet. And she said, after I'd finished about 25 minutes, she said, "Thank you, I feel better." I said, "Good. I'll see you later." And so I went back later in the afternoon, and before I went back, the doctor came up to me about an hour later, and he said, "What did you do to that lady?" And I said, "Why? Is she okay?" She said, "Yeah, she's talking in paragraphs. I couldn't get one word out of her this morning when I went in to evaluate her." And she's telling me her whole life story. I said, "Really?" He said, "What did you do to her?" I said, "I rubbed her feet for 25 or 30 minutes. He said, "That's a miracle. That's unbelievable." So that evening I went back and rubbed her feet for about 15 more minutes to be sure she had a good night's rest. She slept good the morning. She's chalking up a storm. 2 days later, she's off back to home. It was just amazing, the difference in her. So
is there anything connected that you're aware of with the feet which helps digestion?
The digestive area is around the middle of the foot here. So like for your fellow with a GERD problem, if he was to take a golf ball and rub his foot just sitting up and rub it like on a carpet, that might help with that, just to relax the stomach area, get a little better circulation to it. I would try that. But the hot foot bath, those kind of things, taking some aloe vera, that's all helpful for GERD too. All right, well that's
part of the perfect circulation.
Yes. All right, well it's time for us to break. Let's pause for a moment of prayer, okay? Father in heaven, we thank you for making our bodies complex enough and yet simple enough that we can help each other with it. And I pray that you'll bless each one of us with a desire to be a blessing to others around us, with a desire to want to help. And we pray that you'll bless anyone that we might treat with your supernatural blessings. Help us to remember to pray for them. And I pray for Maxine now that you will bless her and this simple treatment, that you will add your divine blessing, supernatural blessing to her. And we pray for your guidance in each day of our lives. May we meet people that need help, and especially that are open to you helping them to know who Jesus is, our Savior and our Creator, and that you made us so amazing that our bodies want to heal all the time. We thank you now and pray this in Jesus' name. Amen. All right.